Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Claimants B, I am going to teach you on how to carry out wound dressing. Wound dressing, you remember that it's a sterile procedure. So it can be a one nurse procedure, or two nurses can carry out this procedure. If it is a one nurse procedure, of course you have to set your sterile field this way. Make sure that everything is set so that you can carry out. Make sure that your sterile glove, your sterile drape, everything is ready before you carry it out. Remember that before you do that, you have to perform hand hygiene, clean the trolley first, then you create the sterile field, right? You open the dressing pack and make it look this way, right? So I have cleaned the trolley and I have created my sterile field already, right? So you have to set it this way, and I have the bottom shelf. Remember, it's a trolley procedure. I also have my requirements, solutions for the dressing. I also have a bandage, and in case the gauze that I'm using it will finish during the dressing, I have extra gauze in this drum, and I have my Cheetle forceps in its container. So as the person that is going to assist me, or if I need more, then I will add more gauze to this. But I doubt much if I will need more, because I have my gauze here enough, and I have all my forceps ready. So now the next thing is for me to identify this patient. Is this the right patient? Remember, in nursing, identification of patient is very important. So I have to identify this patient to know whether this is the right patient for me to dress the wound, right? So let's identify our patients together. Hello, good morning. I'm Nurse Clement, and I'm here to dress your wound. Please, can you tell me your full name and your date of birth? Okay, your name is Chukwuemeka Eze, and your date of birth is 1st January 1999, right? So I have identified my patient, and I have cross-checked with the information I have in the system or patient folder to know that this is the right patient, right? So now, this is Mrs. Chukwuemeka Eze, right? So I have identified her. Let's take, for instance, that this is a diabetic patient, right? Having a wound on her hand, and she's coming to the ward every day for wound dressing. Follow me, let's go and perform hand hygiene to dress this wound. Remember, it's a sterile procedure. Perform hand hygiene, and the first glove that I have to wear is clean glove, right? I have to put on clean glove. Why am I putting on this clean glove? It's because I want to remove this dirty. I have to remove the old dressing. I have to remove this old dressing so that I can dress the wound. So before we remove the pin, place the hand that you're going to dress or the affected area, and place dressing towel. Remove the pin and put it inside receiver for used instrument. The next thing is for me to remove this bandage, right? The old dressing. So I've removed the old dressing, right? After removing this old dressing, the next thing is for me now to remove this clean glove and go and perform another hand hygiene, right? So I'm going to remove this glove and perform hand hygiene. Be careful so that you not contaminate yourself, right? So I remove the old glove, also discard it inside receiver for used instrument. So I'm going to perform hand hygiene, and after which I'm going to don my sterile gloves, right? I'm donning my sterile glove, right? Be careful so that you not contaminate the sterile glove. So I'm done donning my sterile glove. I will discard this at the bottom shelf, right? So I will take forceps, right? I'll take my dissecting forceps to remove. Remember that this is my sterile field, isn't it? So I can pull the trolley close to me so that I can have easy access to it. So the next thing is for me to remove my old dressing using this dissecting forceps, and I use this. I remove my old dressing and I discard it inside the receiver for use swap. I remove this. I keep removing. I discard. So the next thing now is for me to check if the last gauze has been adhered to the wound. Also, as I'm removing, I also observe for swelling around the wound. I also ask the patient if she's feeling any discomfort, is there pain, tenderness. I also ask the patient, right? And while I am removing this, I also observe around the wound to see last gauze has been attached to the wound, to the patient's wound. Then I will pick my normal saline that I poured inside this gallipot, and I will just pour it on the wound directly, or I use dressing forceps to dip it, so just to soak it, so that while I'm removing it, the patient will not bleed, right? So after which I discard this forceps in the receiver for use. Then I pick another one. I pick this time around, I'm going to pick tooth dissecting forceps, and I'll pick it, and I will pick the, and I gently remove this, the last gauze, and I discard it inside the receiver for use, and I also discard this one. The next thing is for me to pick. Then before then, I will just apply my sterile drape, right, to create sterile field. Also apply my sterile drape around, right? Then I pick my gauze that I put inside solution. Then I start cleaning from up down, right, up down, one stroke at a time. Remember, one stroke at a time. And I discard it inside receiver for used gauze, and I carry another gauze again, wrap it around the, and I clean from inside out, right, one stroke at a time. I picked another one, and I dip it also inside the solution, and I clean from inside out. Then I discard. After discarding, and I keep doing this, I keep doing it until I have my desired results. I discard this forceps also inside my receiver for use instruments. So the next thing is for me now, right, is for me now to clean it with normal saline, right? So I dip the last the gauze inside normal saline, and I clean the wound also inside out. I clean it, and I discard. I keep doing that, and I discard. So I have cleaned it with normal saline. So the next thing, if the wound dressing is a wet dressing, the next thing is for me to wet this, right? To wet this, you pick another dressing forceps, right, and dip it inside the solution. Is it Izol, or is it Izol? If it is Izol, then you dip it inside the Izol solution, and press excess fluids, and then discard. Then you place it inside the patient's wound. But again, if a cream is being prescribed for this patient to be applied for this wound, then we also apply it on the wound before we place the gauze. Then I pick the next sterile gauze, and I cover the wound, right? Then I remove the sterile drape, and I discard it. Then the next thing is for me to carry my bandage to cover this wound. I have covered the wound already, so I am free to touch anything that is down under the trolley. I remove the pin, and I wrap my patient's wound, right? So I turn it this way, and I start wrapping my patient's wound, right? And I wrap. If I have assistant, this is the aspect that my assistant will assist me to, like, help me. It's being wrapped completely on the patient's hand. So this, you can use plaster, or you can use pin and just pin it. You can pin it this way, right? After pinning it this way, you discard the draw Macintosh and draw towel. Also discard it, right? So Thank you, Mrs. Chukwuemeka. Thank you for cooperating with me. Please, if you feel any discomfort, if you feel if you have pain, kindly report, right? So now I am done with this procedure. The next thing is for me to what? So doff my glove and then I'll go and perform hand hygiene. So I have performed hand hygiene. The next thing is for me to record. I have to take my pen and paper or record in the patient's computer in the system that I have performed wound dressing done 2 p.m. or 8 a.m. depending on the time you perform the dressing. After recording, then you also record what you have observed. Are there granulations, right? Is there any new tissues coming up? Is the wound affected? Are there rashes? Are there swelling around the wound? All you record those things down. After recording, then you are done with your procedure. Then you discard, of course, this one you discard used equipment, right? Then you discard used equipment. So thank you for watching this video. Thank you for staying with me till the end. Bye bye.